Hello, my name is Brooke Ward. I'm the President and CEO of the Washington Health System. It's my honor to be back with you once again for our ongoing Friday video series, where we attempt to give you updates about what's going on in our healthcare world. And like we have for the last 18 months, we're going to start with COVID. If you look at the CDC COVID data tracker, currently over 95% of all counties across the entire United States are having a high rate of COVID infection in their communities, and that applies to Washington Greene County as well. We're seeing those high rates. In the last 7 days alone in Washington County, 10.72% of all testing being done, both by us and by others, are seeing a positivity rate. In Greene County, that's just under 9%. Now, at our own testing facilities, it's a little under 15% at 14.8. And you might ask, why is the difference? And I think it's because we see a higher number of people who are having COVID symptoms come to us for testing. There's lots of people who are being tested to return to school, return to work, or to travel. I think they're going to some other testing facilities, but they're driving the number down. But if you take those people out, the positivity rate is going to be higher. So they're artificially lowering that number. But even though those people are in there driving the numbers lower, we have a high incident in our community, and that's concerning. Now, you might recall last November we had our peak of inpatients at 58. That was when we had the most number of inpatients at Washington Hospital and Greene combined, and we're almost at that rate now. Yesterday, as of Thursday, we have 48 COVID positive inpatients at Washington Hospital and 6 at Greene, and that's a little less than where we were the last week. And so it's concerning that we're almost at the peak we were a year ago. The silver lining, though, is that we've had a fair amount of people in our community who have got the COVID vaccine injection, both their first and second dose, and I think that's helped keep the numbers low. If not for that, I'm sure we'd have a much worse off situation we have now. So I want to thank all those individuals who got vaccinated to help keep these numbers low. I can tell you, of the people who've been admitted, 83% of those folks are not vaccinated. And so vaccination is keeping people safe and is keeping the illness less severe than it would otherwise be. Now, in spite of that, we're seeing an increase in the volume in our ED departments, both in Waynesburg and in Washington. And because of that, we're experiencing long waits. And so I'm just asking you to be patient. If you show up at our emergency departments, it might be a long wait. We're doing the best we can to try and take care of everybody as quickly as possible. One way you can help is not to come to the emergency department for a non-emergency, and don't please come to the emergency department expecting to get a COVID outpatient test. We don't do outpatient COVID testing at the emergency department. In fact, if you show up at the emergency department, by law, we have to register you, provide medical screening, have a physician or a mid-level evaluate you. You may or may not get COVID tested there, but it's going to be a full workup, and it's going to count as an ED visit, including the charge. And a couple people have come in and been frustrated by that, but that's because by law, we have to do a full emergency workup when you show up there. So if you just need an outpatient COVID test, don't go there. Go to our outpatient COVID testing sites. Those are being done through scheduled appointment with a doctor's order. You can do that by calling 724-579-1684. The testing location is at the Wilfred R. Cameron Wellness Center and down at the Washington Health System Greene. Now, there's been a lot of talk online and in the media about staffing shortages in healthcare, and that's true with us as well. But I know from talking to our peers across the entire industry, everybody's experiencing that. And if we're honest about it, it's happening to factories, manufacturing, food, restaurants, grocery stores, you name it. Everybody's having staff shortages. So it's not a healthcare only issue, although it is impacting us. And we're recruiting as much as possible, but we have more openings today than we have had at any one given time in our 125-year history. There's no doubt about it. That being said, we're not rationing care and we're not preventing people from getting things done, but we're being deliberate about what we schedule, particularly with surgery and other things. So we're trying to recruit as much as possible to fill those vacancies. If you, a family, a friend, neighbor, are interested, I think we have great, excellent pay. We have a great culture here at the Washington Health System. We'd be happy to have you join our team. You can look at the jobs at whs.org/careers to see what we have available, to see if there's a match. Now, let me transition to COVID vaccine and vaccine booster specifically. On Friday, September 24th, the CDC finalized their recommendation for COVID vaccine boosters for Pfizer. Now, they're going to be reviewing Moderna and J&J in the future. That is not done yet, but they did approve boosters for Pfizer, and that's the vaccine we've been using since the very beginning. So based on the latest recommendation now, millions of Americans are going to be eligible to get that booster shot, and that's going to be as follows. It'll be anybody over the age of 65 or resident of a long-term care facility they're recommending should get the booster shot 6 months after getting your initial shots. Anybody 50 to 64-year-olds who have an underlying medical condition should also get the vaccine booster shot. Anybody 18 to 49 who has an underlying condition may get the booster shot. And anybody 18 to 64 who has an increased risk of COVID because of an occupational exposure or institutional setting may also get the COVID vaccine booster for Pfizer. Now, to address this, we're going to reopen our mass vaccination clinics. We're going to have them set up at the Stout Conference Center at the Washington Hospital, and we're also going to have it set up in Waynesburg at the Washington Health System Green. These are going to be based on walk-in only, so no appointment necessary. You can do these by going to the Washington Hospital Clinic. You're going to come into the main entrance, drive all the way back to the back, enter in the H door. Now that's only for the COVID vaccine clinic. Everybody else should enter through the lobby door like you have been forever. But you drive all the way to the back, go to the H wing door, and we're going to have our vaccine clinic there on Tuesdays from 8 a.m. to 2 p.m. and on Thursdays from 12 to 6 p.m. And down at Green, it's going to be in the old Wellness Center space at the Washington Health System Green on Wednesdays from 8 a.m. to 12 p.m. Now, it's important to bring your vaccination card with you. Bring your ID. Remember, you got to wear a mask in all healthcare organizations, so bring that as well. And I would be remiss if I didn't say, if you have not gotten a vaccine, the COVID vaccine at all, please do it. We've been given, thousands of these, and across the world, millions of doses have been given out very successfully. It's safe, it's effective, it protects you and your loved ones. As you heard me say earlier, the people coming in who are not vaccinated are far sicker than those who are vaccinated. It's the right thing to do. Please do it for yourself. Now, transitioning, I want to talk about a few events that take place in October. There's a number of healthcare things that get observed in October, and we don't have enough time to talk about them all, but I do want to talk about a couple. Let's start with domestic violence. October is the Domestic Violence Awareness Month, and this impacts a lot of people in our community. In fact, 1 in every 4 women, 1 in every 7 men get affected at least once in their life by domestic violence. The Washington Health System is working with Domestic Violence Services of Southwestern Pennsylvania to not only raise awareness of this issue, but help make sure that our healthcare providers and the Washington Health System police are trained to identify it and help treat those individuals for that issue as well. Now, if you're experiencing domestic violence, you can call the Domestic Violence Services of Southwestern Pennsylvania hotline. That is open 24 hours a day, 7 days a week. The number is 1-800-791-4000. Please call it if you need it. The second area I want to raise some awareness on is Breast Cancer Awareness Month. And we all know October is important for that. It helps raise awareness around this specific type of cancer. It also helps remind some women that it's time to get their annual mammogram. But one of our very own is helping to raise awareness with this year. Mr. Terry Wiltrout, our Vice President of Clinical Operations, he's participating in the second year in a row in a program called Real Men Wear Pink, where he'll be wearing pink through the month of October to help raise awareness for breast cancer and raise money. If you want to help Terry in this goal, you can click the link below to help support Terry in breast cancer awareness. The last area I want to raise some awareness for is around the 20th Annual National Prescription Take Back Program. This is a program where on October 23rd from 10 a.m. to 2 p.m., which is a Saturday, you can bring in any unwanted or unused or old prescription medications, bring them in a confidential manner, and dispose of them to get them off our shelves, out of our medicine cabinets, and out of our community. You can do that by bringing them into the main entrance of the Washington Hospital or to the ED. We'll have a drop box set up. If you want to bring them in the prescription bottle, that's great. Just peel the label off. Otherwise, you could just dump them all into a little plastic baggie, drop them off. It's confidential. We'll get them out of our community. It's a great program, a great service, and we'll take care of it from there. Those are our updates for this month. Hopefully you found the information useful. I appreciate your time and attention. Until our next video, which is on Friday, November 5th, stay safe.